A very good afternoon to all our viewers today. I am Dr. Anushka from Gleneagles Hospitals, and today we have with us Dr. Sonam Tiwari. A very good afternoon, ma'am, and welcome to our Facebook Live session.
Thank you so much, Dr. Anushka.
So, our topic for today is know more about importance of HPV. Before that, let's hear about ma'am. Dr. Sonam Tiwari is a dedicated and highly qualified obstetrician and gynecologist with over 8 years of experience. She specializes in high reproductive medicine, cosmetic gynecology, laparoscopic and robotic gynecological surgeries with a strong academic background, including MBBS and MS in orthopedic and obstetrics and gynecology, and multiple fellowships. Dr. Tiwari has established herself as a leading expert in this field. Throughout her career, Dr. Sonam has been recognized for her clinical expertise and academic contributions, winning awards for her research presentations and publishing several articles in prestigious journals. Her clinical service ranged from preconceptional counseling and pregnancy care to advanced laparoscopic and robotic surgeries and innovative cosmetic and gynecological process. Dr. Sonam is an active member in FOGSI, PCOS Society, Indian Society of Assisted Reproduction, World Association of Laparoscopic Surgeons, etc. It's a very good for us to have you here with so much experience and to share it with our viewers today.
Thank you so much, Dr. Anushka, for having me here. Today, we've chosen a very important and a very amazing topic, that's HPV, that we have to talk about. I always get very excited when I have to talk about this because this is something that, every little girl to an old woman should be aware of. What is this, how, what kind of infections, what is it bound to do to us, what can we do to not have it, not attract it, because this is something, which is totally preventable. So I'm very happy to be here to talk about it.
Thank you so much, ma'am. So let's begin with our topic. Let's start with knowing what is HPV.
So when we talk about HPV, the full form is human papillomavirus herpes. So what happens is that this HPV virus belongs to a group of viruses which attack the lining of our reproductive organs, especially women, and also organs, the lining of the anus or the throat. So these viruses, when they attack these lining, they are prone to develop infections, and these infections, if they are long lasting, they can produce cancers. Now, what happens is when we talk about cervical cancer in per se, it is a major killer of women. Like if we talk about HPV related cervical cancers, in 2020, there were more than 3 lakh women who died of it. And what is tragic about this is that when we talk about HPV related cervical cancers, this is something that was preventable by a vaccine. So imagine we losing 3 lakh beautiful women to something of a cervical cancer caused by HPV. So when we look at it, it's not just merely an infection. It is something really more than that, which we can cut down, break the chain, and bring down these numbers.
Right. So, are there any different types of this HPV?
So when we talk about HPV virus, there are almost like 200 strains of it, but there are some which just cause merely infections or genital warts. So these are called the low risk groups. Then there are also there are almost like 13 strains which causes infections, which if they are persistent can lead to cancers of the cervix, the anus, the penile, the throat, oral cancers also. So these are called the high risk groups.
Okay, so let's know more about how is this transmitted? How does one get HPV?
Okay, so that's very interesting because when we usually talk about anything related to, the genitals, we think that it is mostly a sexually transmitted infection, but this virus is more than that because the transmission of this virus is actually skin to skin contact. So when we say skin to skin contact, it obviously includes sexual intimacy, but it can also include oral to genital contact or genital to genital skin contact. Because see, if somebody who's got HPV and I've got a bruise over my skin, and if I happen to come in contact with the person or the fluid, uh, I'm prone to carry that infection, right? So more of a skin to skin contact is the mode of transmission for this virus.
Okay. So having known that so many women have been affected by it, how common is HPV?
Okay, so HPV, when we talk about it, uh, it's almost 70% of the cervical cancers today detected are caused by HPV strains of viruses. So it's a very common disease. And what is funny about it is that this is something which can persist, or which can go off and clear from the body if we take care of it. And there are like very very less numbers which if persisted can progress to cancers of different kinds.
Right. 70% is like a huge number.
Yeah, imagine a virus which can be prevented causing
Exactly.
cancers which can be life threatening.
Right. So, what is the age group of people who is generally affected by this?
Okay, so anybody who is sexually active right from the first sexual contact can attract or is prone to have HPV infection. There is no, HPV is not gender biased, so it is not going to affect only the women or only the men, which is a very big misconception. When we talk about HPV, the second thing that comes to our mind is cervical cancer, and then we think, oh, you know what, it's limited to women only. But when we talk about HPV, we talk about cervical cancer because that's major in number. But then there are anal cancers, there are oral cancers, there are throat cancers, there are penile cancers, so men and women of any age who are sexually active are prone. It's also so that if a person is virgin, then we think that, oh, this virgin person cannot have HPV, but it's not, because maybe she's not have penetrative sex, but then if there is any oral to genital contact, then she's still prone to have HPV.
Right.
If we actually look at the numbers, anybody who me, our audience, or anybody who's been sexually active even once have had must have had HPV infection at least once in their life. It's only that because if your immune is better, you'll be able to tackle the infection much better.
Right. So, are there any non-sexual transmission ways of HPV?
So non-sexual, when I say so okay, uh, anybody who's got a cervix or has penetrative sex is prone to have HPV infection. Like as I said, oral to genital is also one thing. Anal to penile is also one thing. And also using the same sex toys when that happens, because this virus is alive for almost 24 hours. So if these things are not sterile well, or used, or shared, these are also some common ways of attracting HPV infection. Also, if a mother has HPV infection in her pregnancy or during delivery, the baby can also have HPV.
Okay.
Because if she delivers vaginally.
Correct.
Yeah.
So, how do we test for it? How do we get to know?
So, HPV vaccine, HPV testing is, we have something called HPV DNA testing, but it comes along with pap smear. So we have to be, everybody who's more than 21 years of age should be undergoing a pap smear every 3 years, and post 30 years, like 30 years and above, everybody should have a pap smear with HPV DNA testing. So when we do a pap smear, we basically scrape some cells from the cervical area and we send it for testing. So when they test these cells, a pap smear basically tests the cells to see if there are any cancerous changes in the cells, okay, or if there are any cervical cells that are changing, which are abnormal. And then if there are any cells that are changing, these cells are sometimes sent and then looked for any particular type of HPV that is present, which might be causing these cell changes. Sometimes it is also possible that your pap smear might just come negative, but that doesn't mean that your HPV might come negative too.
Okay.
So every time that you do a pap smear, repeat a pap smear, do it with an HPV DNA, so that if your pap is negative, but if your HPV is positive, then there are
Mm.
different ways how you should be, repeating the smears accordingly.
Okay, right. So we spoke about HPV causing cancers. How exactly do they cause cancers?
So HPV is a very smart virus.
Mm-hmm.
Okay, what it does is it goes to the bottom layer of the organs,
Okay.
especially the reproductive
Mm.
organs or the throats, the anus, as
Mm.
we spoke of, and it sits there and
Mm.
it multiplies. Now, when it
Okay.
multiplies, it makes different copies of itself
Mm.
and its protein.
Okay.
Now, majority of us, if we are not immunocompromised or if we
Mm.
have a good immunity, we usually clear this virus in a span of 2 years.
Mm.
But if somebody whose immunity is low happens to, keep this virus persistent, and when this virus doesn't get clear, it makes the cells undergo changes.
Okay.
So when these cells undergo changes, there are precancerous changes or cancerous
Mm.
changes, and then these cells start behaving weirdly,
Okay.
and that is when there are changes, cancerous changes that happen. So
Mm.
it is still giving us time, like,
Mm. Right.
there's like 2 years, like, to
Mm.
get rid of it. If we
Mm-hmm.
do not catch it in that period of time,
Mm.
that is usually when it starts showing changes, and these cancerous changes are actually seen at the span of maybe 15 to 20 years.
Okay.
It takes that
Mm.
long to actually make the changes.
Okay. So hearing about this is a little scary. Is there any way to prevent it?
Absolutely, absolutely. It is scary when we know the complications of it,
Right.
because it's a human mind when we always look at, this might cause this complication.
Right.
But when I think we should just go retrospective to look at
Hmm.
what can I do to not just be there in that position.
Exactly.
So, um, having not having multiple sexual partners, or having safe sex, using
Hmm.
condoms, like
Hmm.
when I say using condoms, also it's just the genitalia that you are going to
Hmm.
cover, but the skin around
Hmm.
is still exposed.
Right.
So that is why, not having many sexual partners, or
Hmm.
not losing your virginity at an early age, having
Hmm.
a healthy lifestyle. Smoking is a very big risk factor because it
Hmm.
decreases your immunity.
Right.
And healthy lifestyle, like eating fruits, vegetables, fibers, exercising, these are just very simple steps where you can prevent having these viruses
Right. So, how long does this HPV virus last in
in
the
the
body?
body. As I mentioned, it is dormant for almost like 2 years. Our body
Hmm.
takes like 2 years to get rid of it, and but if it doesn't get rid of it in 2 years or so, then it is called a persistent infection.
Okay. And is there anything that we can do to lower the risk of cancer in anybody who is
Yeah,
affected?
so when I spoke about pap smears, when we
Hmm.
do that, see, imagine I told you, like, an HPV is there. It gives us our body time, like, for 2 years to get rid of it.
Hmm.
If we do not happen to do that, immunity low, it progresses to changing the cells progresses to,
Right.
going to the cancer. So we have enough time. Okay, now if we keep doing our pap smears regularly, which is like a 5 minutes procedure,
Hmm.
imagine every 3 years we can keep a track of if the cells are changing or what kind of cells
Hmm.
changes are there.
Hmm.
Because, okay, HPV doesn't have a treatment, but if there are any changes in the cervix, there are treatment for this. There are surgical treatment, there are radiotherapy, there's chemotherapy, or
Hmm.
depending on what kind of cancerous changes we are looking at,
Hmm.
there are treatments for that.
Hmm.
So every 3 years a pap smear, or every 5 years HPV
Hmm.
DNA testing is a good way to keep us safe.
Okay. Are there any treatments available for it for HPV before it turns into cancer?
So HPV, very sadly, we do not have any treatment for HPV virus
Okay.
infection, but majorly if you work on your immunity, our
Hmm.
body works wonderfully to get rid of it.
Okay.
So if we work on that, 80 to 90% of the times we are able to get rid of the virus within,
Hmm.
24 months.
Okay.
But definitely, as I said, if at all we proceed
Hmm.
to a place or stage where there are
Hmm.
cancerous changes, then definitely there are treatment for that.
Okay. Is there any vaccine or any preventive thing available?
Yes. There are vaccines, and everybody on this planet should be getting that vaccine, because this vaccine should be available to the children right from 9 years of age. Basically, what we mean to say is that this vaccine should be, I mean, the children should be vaccinated irrespective of their gender before they are sexually active.
Okay.
So when we say 9 to 14 years is a good age to vaccinate our children on that. Now, there are some other vaccines which are also available, which are given to the adults after 14 years of age to 26, and there are some newer vaccines which are, available till 45 years of age too.
Okay. So, would there be any difference in the vaccines which are
Yes.
taken
So
in the
there are
adults?
two major brands that are available. One is Servavac, which is an Indian-made vaccine. The thing is that Servavac works against four strains of HPV. So 6, 11, and 16, 18, which the 6 and 11 are the low risk groups, and the other are the high risk groups. Now, 16, 18 usually causes like maybe 70 to 80% are the cervical cancers. But then there are this other 20% category, where high risk strains of HPV are still capable of causing the cancer. So Gardasil 9 works against 9 strains of HPV, both low and high risk, and it provides protection for almost 90% of the times. Like it provides protection that way. And the earlier you get it, the earlier you'll be able to your body will be able to make antibodies against HPV. Because what happens is, supposingly, if uh, if somebody is infected with strain X of HPV, or say, let us say strain 33 of HPV, so eventually in maybe 2 or 3 years, that person might be able to make antibodies against strain 33.
Okay.
But what about the other strains? If
Right.
you are vaccinated, your body is already making antibodies against all the other strains. So your body is capable of protecting you from all the strains that are included in the vaccine. You understand?
Right.
That is why, okay, Indian government has an amazing thing where it's come with Servavac, which is really affordable, but it provides antibodies or protection against only 4 strains. There's Gardasil primary, which also provides protection against 4 strains, and then again there's Gardasil 9, which provides protection against 9 strains of HPV.
Okay, so since there are so many strains of HPV, can one person get affected by multiple?
Yes, that is definitely possible. So that is why when we say that, you should be vaccinating your kids at an earlier age, so that they already have antibodies for all these strains, and they are not infected by any strains that might cause cancer later. If the person is not vaccinated, then obviously the person might produce antibody against the strain that they are infected with, but there will not be antibodies against the others. So you are still prone to be infected with other strains of HPV. On top of that, it is also possible that at the same time you can have 2 or 3 strains infections at the same time.
Okay, so we also spoke about genital warts.
Yeah.
So does somebody who is having genital warts will persistently have the HPV?
So yes, sometimes what people do is genital warts can be taken care like surgically, even if you remove it surgically. But if your body has not eliminated the virus totally, you can still persist to have the virus and spread it.
Okay, so let's move on to the cervical cancer part of it. If somebody has it after the HPV vaccine, after the HPV infestation, would there be any treatment for them?
Cervical cancers, depending on the stage that we catch it, there are different ways that you can approach it. There, as I said, there's surgery, there's radiotherapy, there's chemotherapy. Depending on at what stage we catch the cancer, we'll have to treat it that way.
All right. So can some person spread HPV to someone who is already gotten the vaccine?
Very unlikely. See, supposingly, if somebody is got the vaccine at an age 14 and already has immunity against major strains of the virus, then it's very unlikely that person will be infected with that virus. But if the person is exposed to this HPV strain before vaccination, then yes, that person can be having infection by with the other strain. Also, if the person is vaccinated supposedly with the four strain vaccine, but if the person gets in contact with somebody who's got infection of some other strain, then yes, again you're prone to get the infection.
Okay. So speaking about the vaccine, can somebody who is pregnant get the vaccine?
That's a wonderful question, Anushka. So, yes, you should get the vaccine. And if you happen to understand or find out that you're pregnant after getting a single shot or two, then you can, take a pause and continue the third with the second or the third shot after you deliver the baby. The most of the studies have shown that HPV vaccination do not have any effects on the baby to be born. So you can continue the remaining slots after you deliver.
That's amazing.
Yeah. So I would also like to, talk about it now that we're talking about the shots. So usually, how often do you have to take these vaccines? So at an age group of 9 to 14 years, both boys and girls should, before they are sexually active, need only 2 doses of vaccine.
Okay.
Maybe supposing if today's day is 0, the second dose will come after 2 months. Okay. But if after 14 years or after you're sexually active, that person might need 3 doses, like 0 dose after 2 months and then after 4 months again. And if the person still falls in a category of 9 to 14 years and is immunocompromised, then that person might also need 3 doses. And very wonderfully, somebody, one of my doctor friends had mentioned it to me that if we, ask the parents to circumcise the males or the male kids, they carry less. They are not that great carriers for HPV because the area is clean and the hygiene is better. Okay. So these are small things that we should look into and after when we think about HPV, because when we look about HPV, all we think about is cervical cancer, and the second thing that comes to you is, oh, there is no treatment for HPV. But realize it that it's just a matter of one shot or a vaccine which can save you from a trauma later. Right. Irrespective of the gender you are, both males and females, girls and boys.
All right. So as we are coming to an end to this session, would you like to give our viewers a message about this?
So yes, please, everybody, all category of viewers that we have, you belong to whichever age group, please educate yourself about where you stand about the HPV vaccination, because it is a very simple step. Think about it. Ask your pediatrician, what can you do? Where is your child standing? Why is he or she not receiving the vaccine? And because this can play a major role, educate your children, yourself, your family, neighbors, friends, everybody about safe sex, monogamy, or just educating about your health per se, because this is a single step and you can start at your place, but we can really affect the world throughout.
Thank you so much, ma'am. That was a really informative session.
Thank you,
to all our viewers today to be with us today.
Thank you so much.